All right, welcome back to ABA exam review and our BCBA exam practice question series, where we're going through a set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Albert is struggling to complete his addition homework for math class tomorrow. His dad sits next to him and offers to help. The dad then says, "Why not use your calculator?" and enters the problem in the calculator while Albert is watching. Albert's dad is using a what? Now, whose behavior are we looking at? It's two people in the scenario. When you have two, three, four, five people in your scenarios, you need to be sure you know who you're paying attention to and what behavior. We're looking at Albert's dad here, right? So we know he sits down, offers to help, says, "Why not use your calculator?" which would be the SD, and then enters the problem in the calculator while Albert is watching. So what has Albert's dad done? Well, he's delivered a prompt, right? Why not use your calculator? And then he goes ahead and shows him how to use the calculator, and hopefully Albert will now use the calculator. So what type of prompt is this? A positional prompt. A positional prompt acts on the stimulus, where you would move or alter or change the position of the prompt in order to evoke the response. Albert's dad has not done that. He hasn't repositioned the calculator closer to Albert, anything like that. B, gestural prompt. Gesture is point, show, indicate with body movements what response you want done. He hasn't done that either. What Albert dad has done is modeled. Why not use your calculator? Modeled using the calculator, hopefully evoking the behavior of Albert going ahead and entering the problem himself into the calculator and using the calculator. So Albert's dad has used a modeling prompt, hoping that Albert will now imitate. So it's not an imitation prompt. Don't confuse the two. Okay. Remember, the modeler, right, is Albert's dad in the situation. He is the model. The learner is typically who's doing the imitation. So Albert's dad is modeling. We need Albert to imitate. So Albert's dad is using a C modeling prompt. You, a behavior analyst, are informed that your client used to engage in severe aggression when he was younger while taking medication for ADHD. Once the medication was removed, the aggression stopped. This week, your technician reported to you that the client showed signs of aggression they had never seen before. What will be the best next step? All right, kind of an ethical question, kind of a treatment question. We know prior to treatment, we should review all history. That includes medical, if available, if we have access, and if relevant. In this case, it's very relevant. The medication this client used to take for ADHD made them aggressive. They no longer take the medicine, and they no longer are aggressive. However, your technician reported that this week, there's signs of aggression they'd never seen before. Now, put two and two together, right? New behavior, aggression we've never seen before. Given their medical history, there's a pretty good hypothesis here. So what will be the next best step? A, perform a functional behavior assessment. Well, we don't need to do that yet for the aggression, okay? Given history, given our indirect assessments, given what we already know, there's no need to perform an FBA or even a functional analysis quite yet. Okay. We want to be parsimonious. We want to rule out the simplest explanations, and we always want to rule out medical factors first. So there's a few different things here at play that we need to go through before we start doing FBAs and FAs and that sort of thing. So if we look at C, consult with the parents on any recent changes, that will be our first step. Simply asking the parents, what's changed? Has he started taking medication? Has something in the environment changed? Is something different, right? Because as well as we think we know our families and as communicative as they may be, they're not always telling us everything. And they may have forgotten they told you this. They may not even think about it. Never assume, right, that your clients or stakeholders are thinking about the things you are, even these simple things, okay? They have a lot going on. So we always want to be parsimonious, roll out and go to the first simplest explanation first, which is what's changed? Are we taking medication again? And then D, refer the parents to a medical professional. After you ask about changes, right? Then maybe we say, well, how about we go see the doctor, right? Go back to your pediatrician or whatever pathway you went down prior when he had aggression and was taking this medication. First things first, though, what's changed? Simple question. We don't see aggression. There's a history here. Now we see it. Tell me what's changed, and have them go through with you what exactly has changed in the environment or what variables they've added to diet or medication or whatever it may be. The results of an indirect behavior assessment with two stakeholders reveal that in response to elopement, the parents use reprimands. In response to task avoidance, the parents use a timeout procedure. And in response to aggression, the parents use spankings. The indirect behavior assessment indicates that parents are using what? So be careful here. The immediate response from many people is, well, clearly they're using punishment, right? They're using reprimands, they're using timeouts, they're using spankings. What do we know about punishment? Well, with punishment, we know it decreases behavior, and we need to look at future behavior and how it changes. We don't know how the behavior is changing. We know how the parents are reacting and responding. We don't know if reprimands are punishing. We don't know if timeouts punishing. We don't know if spankings are punishment. We only know if things are punishing if we know the future behavior. So we can't assume, well, they're using punishment. There's not negative reinforcement for many of the same reasons, right? And even if they were attempting these procedures, most likely not attempting a negative reinforcement procedure, what they've done here is jump to default technologies. And default technologies are typically what looks like punishment procedures, right? Without trying other things first. And what happens a lot of times with untrained stakeholders where, you know, instead of going through the systematic process of assessments and trying all these interventions, we jump to default technologies. We jump to spankings. We jump to timeout, right? It's very common. So we can't necessarily say, well, they're using punishment because we don't know. All we know is they're using default technologies, okay? These are all default technologies that as practitioners and as analysts, you want to try to avoid in your interventions as much as possible. You should always start reinforcement-based. You should have treatment packages, and you should parent train. They're not using extinction. There's no extinction going on. We can definitely rule that out, right? So the indirect behavior assessment indicates that parents are using, C, default technologies. Logan decides to use a time delay procedure as part of a stimulus transfer control procedure in a third grade classroom. Where should the time delay take place in this situation? Now, whenever you get questions where you have vocabulary words, for better or worse, right? What do? Well, you need to define them in your head. So we see time delay. Think about what a time delay is. The time delay, we are increasing time or adding time in between the SD and the prompt, giving the learner time to respond. Stimulus transfer control procedure, systematically transferring control from SDs to SDs. Many times this is fading prompts. Now that we have that out the way, let's answer the question. Where should the time delay take place in the situation? Well, by going through that process, we just answered that, right? Where should time delay take place? A, between the SD and the response. Technically, sure. But is there a more specific and precise and better answer? Yes. If you look at B, between the SD and the prompt, that's where the time delay really should go. I give my SD, I wait, then I prompt. I'm allowing time for the individual to respond, right? We're trying, especially here, in most cases, to transfer control from the prompt to the SD. We need the SD to evoke the behavior, not the prompt. C, between the prompt and the response. No, if you're going to prompt, right, we're just looking for the response. The prompt is, the whole purpose is to evoke the response. Time delay needs to occur between that SD and the prompt. So you're giving the individual enough time to respond. And if there's no response, then you prompt. We can reduce behavior through punishment or extinction. However, when we reduce the behavior, what else should we do? We've asked variations of this question before because it's really important. In the 5th edition task list, they ask about the fair pair rule explicitly, which says if you take something away, we've got to give something back, as in behavior. If we're going to go around reducing behaviors and taking away behaviors, what we're doing is taking away ways that our clients access the environment. And these might not be socially valid, they might not be safe, they might not be appropriate, but they're ways our clients access the environment. So if we're going to go around and take away access and functional behavior, we need to add something to their repertoire to replace it. So if we are reducing a behavior, what else should we do? A, teach a new behavior. Sure, right? We want to teach a new behavior, but is there more specifics, right? We're looking for the best answer, the most precise. Well, B, teach a functionally equivalent behavior is much better than teaching a new behavior. If I take away screaming, which is how you get food, me teaching you a new behavior of writing your name on the wall or writing your name on a piece of paper, that's not the same thing. That's not meeting the same function. All I've done is taken away your ability to get food, gain access. Okay. So teaching a functionally equivalent behavior is really what you're looking for. So you teach communication. Yeah, sure. Sometimes, right? If it's appropriate, communication might be something we teach, but not universally. B is a better answer. And then D, negatively reinforce the behavior for reduction. That answer doesn't make sense. You don't negatively reinforce for reduction, right? Reinforcement increases. So reducing behavior through punishment or extinction, right? When we take it away, we need to teach a functionally equivalent behavior. Remember the fair pair rule. What you take away, you've got to add. Your daughter is struggling in reading class, so you are referred to a specialist. The specialist informs you that they want your daughter to complete a 5-day assessment before intervention starts in order to gather data. What type of data is the specialist gathering? Pretty straightforward question, I would think, right? We're looking at the type of data. We know daughter is struggling in reading, so you're referred to a specialist. They want your daughter to complete this assessment before intervention starts to gather data. So we're gathering data prior to intervention beginning. Is it a frequency? Well, we don't know. We don't exactly know if it's continuous, discontinuous. We just know it's data. And data prior to intervention is going to be B, baseline. It's not intervention data because we haven't even started the intervention. And it isn't maintenance because maintenance is post-intervention. We're looking for pre-intervention. If you look at B, we have pre-intervention. C is intervention. D is post. So we're looking for pre-intervention. We are looking for B, baseline. 4 weeks, you worked with your client on tracing their name with a dry erase marker. This week, they finally were able to do it independently. However, when you handed the client a pencil and asked them to trace, they could not complete the task. What is most likely occurring? All right, common issue, right? We teach a skill with a particular stimulus in a particular setting, and then we try it with other things. Can't do it. That's why we have our generalization strategies, right? Train loosely, multiple exemplars, common stimuli, right? In this case, we've kind of failed to do that, okay? We taught the client to trace their name with a dry erase marker. Great. They do it independently. But then you give them a pencil, can't do it, okay? What have they failed to do? Well, they've failed to, there's a lack of stimulus generalization. That response of tracing needs to generalize from markers to pens to pencils to chalk to crayons. Anything you write with, that behavior needs to generalize across those stimuli. B, there's a lack of response generalization. Well, we're only looking at a single response, right? We just want tracing, but we want tracing to occur across multiple stimuli. C is a lack of maintenance. Well, we didn't teach how to trace with a pencil, so we can't test for maintenance. And then D, there's regression. Regression is not a technical word, okay? We can't say, well, they regressed. We never taught it. They've never demonstrated it. They've never shown they could do it. So how could they regress? All they've done is they failed to generalize across stimuli. And as BCBAs, it's kind of our fault because we should be programming for generalization at all times. Which of the following is not a priority for any ABA practitioner who chooses to use restraint as part of an intervention? Now, restraint, always last resort, only as necessary, only as needed. Very dangerous, can be very harmful. Be very careful with restraint, okay? Question is asking what is not a priority for an ABA practitioner if you choose to use restraint. A practitioner should understand the legal and ethical ramifications of restraint. Absolutely different states. Sometimes some states outlaw it. Some states have very strict regulations. You need to know these things because if something goes wrong, you don't want to find yourself in a legal battle, right? B, practitioner should be trained as required in restraint. Absolutely. You need to be trained if you're going to use it. Don't think you know how to restrain if you don't. Again, very dangerous. C, restraint is never an acceptable intervention to use in ABA. It's not necessarily true. It should be last resort. It should be avoided at all costs. Sometimes it's necessary. If necessary, we need to understand legal and ethical ramifications. We need to be trained, and we need to have a monitoring system in place. If you think restraint might come up, you need to have a systematic way to monitor that restraint. Data, reporting, everything. Restraint is very serious. It's very dangerous. It can be very harmful. We've got to do it systematically. We've got to be smart, and we really want to avoid it whenever possible. So, which of the following is not a priority for any ABA practitioner who chooses to use restraint as part of an intervention? C, restraint is never an acceptable intervention to use in ABA. Fantastic. Like and subscribe for all of our updates, behavioranalyst.study.com, for our study materials, including our combo pack. As you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.